Hi, my name is Dr. Sandeep Satsangi and I'm a lead clinical hepatologist and transplant hepatologist with Manipal Hospitals, Bangalore. Today, I'm going to talk about a very important topic called as viral hepatitis. Viral hepatitis can be of two types. One is acute viral hepatitis, one is chronic viral hepatitis. So what do we mean by acute viral hepatitis? Acute hepatitis typically means wherein the virus comes into your body, creates a lot of swelling in the liver, gives you a lot of symptoms, and then it would leave the body, usually without causing a lot of problems. Chronic hepatitis on the other side, chronic viral hepatitis, wherein the patient usually will not have any symptoms. Slowly the virus will be harboring inside the liver, creating a hepatitis or swelling of the liver which can lead to scarring. So how do we understand these conditions? Acute hepatitis is typically caused by hepatitis A or hepatitis E. Hepatitis A or hepatitis E, typically you get it by consuming a improper source of food and water, and that's the source of it, the oral route of it. If the water is contaminated by fecal source, that can cause hepatitis A or E. It starts with some fever, some abdominal pain, some fatigue, lethargy. You start feeling tired. Slowly you might start having itching, the white of the eyes start turning yellow, you start peeing out urine which is looking more and more yellow. And at this point of time, some patients actually improve spontaneously, but some people require medical help. All in all, more than 98% of patients are going to recover completely, but there is a subset of patients in whom even acute viral hepatitis can trigger something called acute liver failure. This is a catastrophic condition, requires intensive medical therapy, and if managed well, many patients can come out without a liver transplant. But some subset of patients who are advanced in acute liver failure and who are not recovering or not responding to medical treatment require a transplant. Vis-a-vis, coming to chronic viral hepatitis, it is typically caused by two viruses called hepatitis B and hepatitis C. So acute hepatitis was caused by hepatitis A and E. This is caused by hepatitis B and hepatitis C. This hepatitis can slowly linger in the liver and lead on to scarring of the liver called as fibrosis. So again, your ultrasound scan is not going to show anything. And if you don't come for a regular checkup, that's where you're going to miss it, that hepatitis B and hepatitis C can lead on to fibrosis, and subsequently it can lead to cirrhosis and also liver cancer. There are very, very, very good therapies now available for hepatitis B, which can control the virus and prevent this hepatitis B from going into a stage of fibrosis and cirrhosis or liver cancer. For hepatitis C, you can completely cure the virus and kill the virus by a very good regimen which can just be given in 3 months to maximum of 6 months. So if you have hepatitis A, hepatitis E, B or C, if you ever heard of any of your relative having this, please guide them to a hepatologist so that adequate medical treatment can be given and they can fight this infection. Thank you.